Good evening, everybody, and a warm welcome to today's webinar, which is based on the topic Sunset and Sugar, a clinical approach to summer diabetes care. On behalf of the Metabolic Women's Alliance, I thank all our speakers, our moderators, our panelists, and participants for joining us this evening. So thank you individually to each of you for being a part of today's program. And at this point, I also express my heartfelt thanks to Dr. Dhruvi, Dr. Priyanka, and Dr. Nimi for being the guiding lights at each and every step of this webinar, from the planning to the organization, and guiding me through this entire routine. So thank you all. And so moving on to our topic proper. Summer. All of us are experiencing it right now. It's terrible. We are all complaining about it every single day. So besides that, we are also having trouble with our patients, especially the diabetics. Whether it is simply traveling, I can't take my medicines, it's the hypoglycemia, it's the dehydration, it's the very well-meaning plate of delectable sweets brought by our neighbor, whether it's the seasonal fruits like the mangoes and the jackfruits. So we are facing a lot of challenges. And so that's what we are going to talk about today. What are the challenges we face in our OPDs, and what are the ways that we can handle this. And we are eager to hear the different perspectives from our esteemed panel. Without further ado, we will go on into the first topic. Our first topic for the day will be summer stressors in diabetes, hydration, electrolytes, and infections. And to moderate this session, we have with us Dr. Sarita Kakani ma'am, who is the Managing Director and Consultant Diabetes Care Physician of the Apollo Sugar Clinic in Vijayawada. Ma'am is also a very humble, extremely approachable, down-to-earth person who readily accepted being the moderator for this session. Thank you so much, ma'am, and I'm handing over the session to you.
Thank you, Dr. Varsha, for that very humble introduction. And it is always happy to be part of such a vibrant women group, Metabolic Women Alliance. And very regularly, every month, there is a program happening. So it is very nice to be a part of such initiatives. And today's topic is very relevant to us, especially in this season, as Dr. Varsha already said. We already might be seeing a lot of things which we are going to discuss today in our OPDs. So it is going to be very relevant for us with respect to summer and care in diabetes patients. So without much ado, I'll just start off the questions to the panelists. Before that, I would like to introduce our panelists today. The first panelist is Dr. Ashna Patil. Dr. Ashna is the consultant diabetologist at Stop Diabetes, Dr. Ashna's Patil Complete Diabetes Care, and she's also attached to Tunga Hospital. She's a member of various professional bodies like RSS, DI, and TGNS, speaker at national conferences, faculty, and organizing chairperson in CID and DRS. She has presented many abstracts at many forums, both national and international. She also happens to be the reviewer for International Journal of Diabetes in Developing Countries. So welcome, Dr. Ashna, for today's session. Next up is Dr. Pavitra Nagaraj. Dr. Pavitra is a pediatric endocrinologist, senior consultant at Narayana Health City, Bangalore. So she happens to be practicing the pediatric and adolescent endocrinology. And currently she serves as a secretary for the Pediatric Endocrinology Association of Karnataka. Also, she served at the EBM IAP Bangalore. And she was a past treasurer and joint secretary for the Pediatric Endocrinology Association of Karnataka. She is also an author of a Kannada magazine called Sutra, which is related to science and health. And she's also served as faculty at state and national level conferences. Welcome, Dr. Pavitra. Yeah.
Thank you, ma'am.
Next up is Dr. Shruti Seth, who's the director and the diabetologist at the Sweet Life Clinic She's a member of RSSDI and a certified insulin pump trainer. She's a co-author of various chapters in national and international textbooks and also has published papers in national and international journals. Welcome, Dr. Shruti, to today's session.
Thank you. Thank you for the introduction, ma'am.
So with this, I would like to give the first question to Dr. Ashna. Yes. So, Dr. Ashna, how does summer heat influence the blood sugar levels, the insulin sensitivity, and the overall diabetes control?
Yes, very good evening, everyone. And at the outset, I would like to thank this group, Metabolic Women's Alliance, for having me here and to be able to connect with everyone on this platform, which is truly a sisterhood. I'm very happy to be here. Thank you so much. Coming to the question, I think we need to understand that heat fundamentally rewires the way your body processes fluids, sugars, and medicines. Okay. So what is happening is heat can push your glucose in either direction, depending on the fluid status, whether they are dehydrated or not, whether they are doing activity, exercise or not. And also at the same time, it makes it very variable. So it's very unpredictable. So there's a lot of glycemic variability which is happening in the body. So let us understand how the same dose of medicine, same insulin tablets, if taken on a summer, in the hot summer day, in the summer season, okay, it's different, how it acts differently as compared to any other normal day in any other season. What is happening? Basically, hyperglycemia is caused in the body by dehydration. As we know, in the summer, there is dehydration which is occurring in our body through, of course, sweating, which is the body's mechanism to cool down. So through that, we are losing fluids, as well as we are losing fluids through the kidney because of the osmotic diuresis. So all this dehydration is causing increase in the concentration of your blood glucose. Now we must understand this is increase in concentration of the glucose. Okay, something you can imagine, like if you are boiling water with sugar, and when the water evaporates, how the thick sugary syrup remains. So it becomes very thick and concentrated. Same way in the blood vessels, the blood sugar gets concentrated, which again gives trigger. So it's a vicious cycle. Concentration, hyperglycemia, and already, as you said, our patients are having mangoes, this, that. So the sugar is already on the higher side from first. In that, we are adding hyperglycemia due to dehydration. On top of that, the heat stress which is caused in the body, that can also cause release of counter-regulatory hormones like cortisol, adrenaline, which again further add to the hyperglycemia. Then when the people are moving out in the hot sun, because of the sunburns, which again adds to a layer of stress. So all these factors can increase the sugar in your body. On the other hand, sugar can also drop. Patient can go in hypoglycemia. Now, what is happening is when a person goes in the sun, is exposed to the sun, there is a vasodilatation. The blood vessels expand, okay, and they physically expand, they cause rushing of the blood to the surface of the skin. This is mechanism, as we said, just to cool down the body. So take the internal heat out of the body, the blood vessels are expanding. But normally a person who is taking insulin, the insulin would be absorbed at a steady rate. But due to this massive rush of blood to the periphery because of the vasodilatation, the insulin absorption is very unpredictable. It is even faster. So faster the insulin is absorbed and the sugar can drop. If you add this, you couple it with, if the patient is exercising or is not eating well. So all this coupled can cause the patient to go in severe hypoglycemia. So hyper as well as hypo, this is, that goes on, is unpredictable. So yeah.
Yeah, so as Dr. Ashna rightly said, there is more volatility in the glucose profile. So a CGM will give us the right, what is the level of the
Definitely.
glucose in the
It will
patient.
give a better insight.
Yeah, better insights into glycemic variability. As you rightly said, summer causes both hyperglycemia as well as hypoglycemia. So thank you for that. And the next question is to Dr. Pavitra. So Dr. Pavitra is there. Yeah.
Yeah, I'm here.
From a pediatric endocrine.
Ma'am, you're muted.
Yeah, Dr. Pavitra. So, what from a pediatric endocrinology perspective, what are the key summer-related hydration challenges faced by children with diabetes?
Yeah, thanks, Dr. Sarita, and thank you for giving me this opportunity where we're discussing type 1 in children during summer. Because just last week, few of the parents had put in our WhatsApp group, we have a WhatsApp group, and he had put up saying the child is doing well. But then when I told him to put CGMS, that is when I saw that there are a lot of hypos as well. So when we talk about hydration, as Dr. Ashna has rightly said, there are hundred of things which does matter when we talk about blood glucose. The first and foremost is the child was confined to schools before summer, and now the child goes out to play. So there is more physical activity which is causing more dehydration because they're not consuming adequate water when they go out. The second thing is sweating. They do not sweat as the adults do. So they do not get to know if they're sweating and they have to have adequate water. So they will not know that when they are thirsty and when they have to take water. So that is the second point what we are looking at. And also the travel, the vacation during summer, that also causes a lot of hampering in the blood glucose levels. So it is not only hypoglycemia, but also we see hyper is because of the energy drinks. When they go out to play physical activities, they start drinking the energy drinks just to get that energy boost. So that again causes hyperglycemia. So overall, we do have a lot of challenges during summer, and also they're out of their routine, right? So they get up late and they sleep late. So all that does matter during summer and the blood glucose, and we have to look into the diabetic ketoacidosis as well. And now because of summer, they start eating outside, loose stools, vomiting, all that illnesses. So we have to look into many things when it is summer, and it's just not carbohydrate, it is just not many things. And as Dr. Rashna said, CGMS, that is also a challenge because many of my children are coming saying this CGMS is slipping off because of the sweat. So we have to even put a sticker, stick that to the skin. So a lot of other issues does pop in during summer.
Thank you, Dr. Pavitra. Yes, summer is like highly variable. They will have summer camps and all. So, as you rightly pointed out, there are many issues which have to
Yes.
be tackled during summer in children. So, with that, we go to the next speaker, Dr. Shruti. So, for Dr. Shruti, which common summer infections most frequently destabilize diabetes control, and what early signs should prompt evaluation?
So, yes, good evening, everyone, and just thank you for giving me this opportunity. And it's a very nice topic. I think, I don't think anyone has ever discussed this topic in any of the meetings. It's a very practical and very nice topic that we have chosen today. And thank you for letting me be a part of it. Coming to the question, the common summer infections that worsen glycemic control. So basically, the common summer infections I would say is that the normal gastroenteritis, foodborne infections that are seen more in the summer season as compared to the other seasons. Again, because of the summer, because of the high heat, the food tends to spoil faster, and yes, kids are not able to make that difference that the food is spoiled or whatever, and they tend to eat outside more when it's the summer season is going on. So they're traveling, and as ma'am's very rightly said, that the whole routine has changed. So that is one of the things which is, I think, the most common acute gastroenteritis. Another thing that I have seen in my practice is summer colds. It's like viral infections because of the changing weather. Like nowadays, we see a lot of different weathers, different weather in the same day. So in the morning it's a little cold, in the afternoon it's very hot, you know. So because of this change in the weather or the temperature during the day, it causes a raise and a fluctuation in the stress hormones for the kids, which actually not only kids, for all our adult and everyone. And that cortisol and catecholamine surges can cause a lot of hyperglycemia, which is actually we are not expecting that because we are taking the regular medicines and everything, but still this happens. And in these cases, there is a chance of viral infections, and now that viral infections itself will cause more hyperglycemia, and it becomes a vicious cycle. So that's like these summer colds that I've seen a lot, the acute gastroenteritis. And another thing that I've come across is the UTIs. So people, they do drink water, but it is as and when required. And especially I've seen, I'll just make a point here that we are Women's Metabolic Physicians Alliance, and I've seen this in many of my female diabetic patients that no matter what the summer is, no matter any of the season, they tend to drink lesser water as compared to males, with the tension in mind that I'll have to use the washroom, so I don't want to go anywhere. I don't want to use the outside washroom, so I'll drink less water. So then what happens is that urine concentration happens, and in the hot weather, they are dehydrated, there's urine concentration that happens. It leads to a lot of UTIs, and that worsens their glycemic the glycemic profile as well. And so much so that ladies who have diabetes and they are traveling, they tend to end up with even severe AKI kind of situations because of just not drinking enough water and stopping, they're not going to pass urine. So this is one of the major things that I've seen in my practice. So these are the few things that I've seen. And other than that, the early warning signs that should prompt clinical evaluation is the persistent glucose readings. So this is another thing that I do in my practice, is that I make sure that no matter what the season and no matter what, they should be checking their sugars. We should be having a kind of a group or something where the patients can interact with the team at place at the clinic, and they can just give their sugars and everything. And when it comes to type 1 kids or something, then we can keep a focus on high sugars, and along with that, the ketone bodies. Other than that, acute gastroenteritis, there is always vomiting, diarrhea, and this kind of situation. Then, of course, they have to come to the doctor and talk to them about the signs of dehydration, like less urine output or dryness in mouth, dizziness, lots of thirst. I think these are the few things that we can tell our patients to keep in mind, especially in this season.
Yeah.
I don't know if I've covered everything, but yeah, this is just
Yeah.
from the top of
I
my
would
head.
like to add one more thing. Foot infections are also common during this summer
Yes,
because
foot
people who use
infections.
socks and shoe, because of the sweat and moisture, they tend to develop some candidal infections in the foot or foot ulcers, or even barefoot walking in temples during summer can cause burns
Absolutely.
because of new.
Sunburns. Yes,
Yeah,
yes.
sunburns
Burns.
are also happening. So thank you,
Yes,
Dr.
yes.
Shruti. And again, we move to Dr. Ashna for the next question. So this is about the common misconceptions which people in diabetes have about using electrolytes, sugary drinks, and how should they maintain hydration? What are the common misconceptions they have about hydration?
Yeah, I think this is really a very important question because even patients in my OPD now, when they come to me, they say कि हम ये ले रहे हैं tetra pack. It is छाछ in a tetra pack, and when they show me the label, it is having 2.4 gram sugar. So we don't read the labels, which are having all hidden sugars. Then one patient told me he's having lactose milk, but again that also had sugar. So they feel that all beverages are hydrating equally. तो सब ले सकते हैं, शुगरी सिरप्स, जूसेस, ये डे मार्ट के अंदर सब रखे हुए हैं, ऑल दैट, सिरप्स, कोकम सिरप्स, दिस दैट. Because what is happening, because of the dehydration in the body and all the heat exhaustion, they have a lot of thirst. So when they reach out, they are reaching to all these sugary syrups and drinks rather than water. So can you imagine if your engine is overheated, if you're putting sugar syrup on the engine? No, you will put water, right? So we must first of all explain to the patient that water alone is enough. Hydrate yourself well. Don't reach out for these drinks, because they are definitely high in the calories. They are having sugar. They're going to raise the sugar in patients who are already uncontrolled. That is going to be disastrous for them. Even they say coconut water is natural, it is healthy, but even a cup of coconut water, 240 ml, that will have 6 to 7 grams of sugar, which can raise your blood sugar to 100 milligram per dl within 30 minutes. So that spike is going to happen, and in a person who's already having high sugar, it is going to be bad for him and give rise to all the infections which we just now Dr. Shruti has enumerated. So that is why all syrups are not same. We must advise them that portion size is very important, okay, and you can alternatively give them option for much more natural sources for hydration. Water is definitely there, but they can also have chas, that is buttermilk. They can go for the lime water made at home without sugar. They can add a pinch of salt in that. They can go for this cucumber infused water, herbal teas. So all these options are there with them. They should go for that rather than this. And also the mechanism of ingestion, that is also equally important as the kind of fluid. So if you are waiting till you are thirsty, as Dr. Shruti said, they only drink when they are thirsty. So you must not wait for that unless you are totally dehydrated and then you are drinking water, because by that time your body is already gone into 5% dehydration. There's already blood volume glucose which is high in concentration. So first of all, tell them to take sips of consistent sips of water continuously, rather than gulping all the water at one time when they are very thirsty. You can imagine, like if you have a pot which is completely dry, if you put the entire pitcher of water at one time, will it be absorbed in the soil? No, it will not. Half of it might even fall out and flow out. So you have to give time for the water to absorb. Same way is your GI tract, in which there are these stretch receptors. And if you take a lot of water at one time, they will stretch, they will expand, they will send the signal to your kidneys. And the kidneys, on the other hand, will, take out this excess of water through the body. So whatever you have drank, that will go out through the bladder, and it will not actually go to the cellular and your, deeper tissues for that deep hydration which is needed. So this is one of the misconceptions. Very importantly, as we discussed now, that monitoring. So more frequent monitoring should be advised to them. Monitor more than frequent, so that they know if their body is going in hyper or hypo, because symptoms of hypo can also be confused with heat stroke and heat exhaustion, dizziness, confusion, all these things. Then also we must advise them to keep all their the insulin, the test strips, CGM, all these things should be stored well, so that because of heat, the damage is not there and they're working properly. So all these
I
things should
think
be
I
kept in
think that
mind.
is going to be discussed in the next session with respect to the gadgets and the drugs.
Oh, I was not
So
aware.
I think you were very clear about the misconceptions. One is you should not wait till you're thirst. And you should not always think that sports drinks are good, coffee is good,
Yes.
it keeps me cool.
Even
and
ORSL, which is now in the
ORS
market
has to be-
advertised as ORS, but it is having more than double the quantity of sugar in it.
Only
So
when
that
there
should
is
be
excess
avoided.
physical activity or for a prolonged time, then we need to advise ORS. Otherwise, I think plain water is good. Yes, Dr. Ashna, thank you very much. As we are running short of time, I would like to ask the next two questions for the speakers. Please summarize it in 2 to 3 minutes. So I will be going to Dr. Pavitra next. What anticipatory guidance should clinicians provide parents regarding hydration, electrolyte balance, and heat-related illness prevention in children?
So I think Ashna has already
Dr.
covered,
Ashna has covered.
including type 1 as well.
Yeah.
So So only I want to add here what Dr. Ashna said, ORS-L, that is what the electrolyte Tetra Pak was available, is banned now because our pediatrician, Dr. Shivaranjini, has fought for it and she has removed that from the market. So we have to applaud her for that. So ORS powder can be prepared, but again, the children are reluctant to drink that. So the best way to have tender coconut water, which does not include sugars. The second one is buttermilk made at home. Not the chas, what Dr. Ashna said, buttermilk made at home with simple salt can be given. The other one is lemon and salt with water. So let the children carry that wherever they go, and that can, and yes, Dr. Ashna said, keep drinking, don't wait for the thirst. So keep scheduled water intake, what we can tell it as. So that has to be followed. And the most important in children is because they have summer camps, they go out in the evening. I would prefer them to check their 2 a.m. and 3 a.m. blood sugar levels because there can be hypo and hyperglycemia depending on aerobic or anaerobic activities they have. So they can either have hypo or hyper. So it is very important that they do check their blood glucose. See, at the end of the day, the summary of everything is blood glucose monitoring and hydration. So that has to be kept in mind.
Yeah.
And I think everything else is covered by Dr. Ashna.
Yeah, we should also tell them about the sick day guidelines not to stop insulin. That also has to be advised
Yes.
to the parents. Yeah. Thank you,
Yes,
Dr.
yes.
Pavitra. Next, I come up to Dr. Shruti again. Yeah. So, Dr. Shruti, what practical OPD strategies can help clinicians reinforce this hydration advice, sick day rules, and timely escalation of care during summer months?
So, OPD strategies point of view, I think all three of us have kind of touched upon it. The thing we can keep in mind is that at our OPD, when the patients come to us, like most of our patients, they're going to come to us and they're going to say they are going for a summer vacation or anything. Be whatever it is, we should be having a good communication with the patient. They should know how to stay in touch with us. Uh, yes, hydration we have already discussed. We need to teach the patient that at least the simple way you can just tell them now we have a lot of gadgets and everything. I think we'll be discussing that in the next session. That you can, there are water reminders, even in our normal smartphones, also you have water reminders. In your watches, also we have water reminders. So that kind of thing you can, it becomes fun filled for the patient. If it's a child, also it become fun filled for them. So that way, water reminding can be done. Sugar monitoring is definitely very much important. So, as Dr. Pavita very rightly said, hydration and sugar checking. These two are very important. And in definitely in type 1 diabetes, if the sugars are persistently high, ketone monitoring would also be suggested by the clinician by us. Not everyone is accessible for it's not accessible to everyone probably at as of now, but we can always tell them if we have a good communication set up between the patient and the clinic, so that would definitely help. It can be through any way, whether it's a WhatsApp message or it's an educator or anything that is at an individual clinic level. And when it comes to medications, we need to tell the patients that when you fall sick, let us know. You don't have to stop any medicine, whether it is a tablet, whether it's tablets with type 2 diabetes or it's insulin with type 2 or type 1 diabetes. You don't have to stop it, but definitely sugar monitoring has to be increased and contact us. So when you contact us, we'll be able to guide you as to how much you're eating and what is the issue, and we can guide them accordingly. And I think that's it. We can just tell them that they can, we can educate them to strategize themselves itself, whether it's like a normal infection, they are not feeling very good, then definitely they have to come up to the clinic and not just wait for things to get better by themselves and not self-medicate. That is one of the biggest things that normally happens because patients are on vacation. They won't they tend to not contact the doctor, and they might take an NSAID, or they will take some antibiotic just over the counter. So that should not happen, because they are already taking insulin, they are already taking some other OHAs. So they have to be telling us that if they're falling sick, and then we need to discuss with them what medications need to be taken and what need to be avoided.
Yes.
So
Thank you, Dr.
that's
Shruti.
it.
I think that was a good summarizing. And we also can encourage patient handouts at our clinics and keep reinforcing them at every visit. Like, how much water are you drinking? Are you keeping yourself hydrated? Kind of things. Stick some posters in our OPD waiting area. So these are some strategies which can help improve the awareness on hydration. So that's it. With this we come to the end of the first session on electrolytes and infections. So we move on to the second panel discussion. Over to Dr. Varsha. Thank you all the panelists. You were all wonderful.
Thank you.
Thank
Thank you
you.
so much.
Thank you.
Just before we move on to the next topic, we have a quick question in the chat box whether coconut water is okay for type 1 diabetic patients.
Absolutely, because it's a natural sugar. It's not a complex sugar where it'll increase the blood glucose values. Usually and routinely, I recommend all my type 1s, they can have tender coconut water. But yes, there is a myth saying potatoes are also avoided, coconuts are also avoided, but they're all myths. Please, we can provide them anything with under the cover of carbohydrate count. So don't avoid anything, they're all myths.
In portion
Just,
size, I think we can take them.
yes,
Yeah,
we added
Yes.
just that portion sizes need to be
portion
managed.
size.
And I feel like just if I can add one more point, that every patient is different, every person's body is different. Like I've seen a normal orange causing different kind of a spike for for different patients. In some patient, a normal orange can shoot the up almost to 150 points up, but to another patient, it's not doing anything. So eventually, even monitoring for the patients, for every patient would help guide that what food is okay for them and what not, and in what portion size.
Yes, that's a point. Very well taken, ma'am. I think any further questions in the chat box, we will take it up at the end if time permits. So thank you, Dr. Sarita, Dr. Ashna, Dr. Pavitra, and Dr. Shruti for joining us today and giving us so many wonderful insights, which I'm sure we will all use in our day-to-day practice. And now we'll be moving on to our the second panel topic for today, which is diabetes care in summer, where we are going to deal with the drug stability and technology in real world practice. So to moderate this session, I would like to invite Dr. Priyanka, the most charming and the one of the pillars of the MWA, and a very good friend as well. So she's a consultant and a metabolic physician, founder and director of Metropolis Clinic. So ma'am is going to chair the next session and guide us through the topics for the next 20 minutes. Over to
Okay,
you,
thank
ma'am.
you. Thank you, Varsha, for the wonderful introduction and the wonderful topic. Also, she only chose the topic. She only made everything from the flyer to the content to the question to everything. She did it herself. Really, hats off to you.
Thank you.
Okay, so we have topic now, the drug stability and the diabetes technology. How we should use it in a summer. So for that, we have expert panel with us. I welcome Dr. Hina. She is a consultant physician and diabetologist from Jamnagar. She is practicing Jamnagar more than 12 years. And she is also, apart from that, she is very good singer and dancer. I also welcome Dr. Akshaya Shetty. She is a consultant physician and endocrinologist from Mumbai. She is very well known, renowned practice in Mumbai. Welcome, Dr. Akshaya. I think she has been the first time on board to the MWA. Yeah. And I also welcome Dr. Saranya. She's recently joined Metabolic Women's Alliance. She's also a consultant physician and diabetologist from Chennai. She's having experience of more than 7 years. I welcome all the panelists. And now I'll start discussion, and my first question is to Dr. Akshaya. Akshaya, right now it is a vacation period. Okay, all kids are is having a vacation, and most of the time, patient comes to us and ask that, ma'am, I'm traveling via bus, via train, I'm going for a vacation, it's extra, and he is on insulin. In such a case, how do you counsel that patient about his traveling to do's for our hypoglycemia, insulin storage, dose adjustment, and anything is there, how he should monitor his sugar? So, how do you counsel such patient?
Good evening, everybody. This is like ma'am said, this is my first time in this alliance. Thank you, everybody, for giving me this opportunity. Also, very interesting topic. Yes, insulin dosage, like the panel one discussed and Ashna madam discussed, can vary during the summers because of faster insulin absorption. So people, when traveling in the summer heat, we would advise them for frequent monitoring every 4 to 6 hours, especially for people who are on intensive insulin therapy. Mainly because of faster insulin absorption because of the summers and dehydration, like the panel one discussed. So ask the patients to mainly carry it in insulated pouches, avoid keeping directly on an ice pack or freezing it, and mainly carry it in hand luggage, not put it in your suitcases, and mainly avoid keeping it directly outside in the sunlight. Opened insulin can be kept around between 25 to 30 degrees, and frequent monitoring, and in case of any dehydration, illness, gastroenteritis, as mentioned by the panel one, reduced dosages, 10 to 20% of the prandial insulins or total insulin requirements of the day can be tapered, especially when patients are traveling, or mostly when the patients are field workers, they have outdoor activities, and during any exercise more so.
Thank you, Dr. Akshaya. And recently, people also not only also using GLP-1, so
Yes.
for diabetes. So it is the same way they can carry their injection as way they insulin. So we just need to guide them, even the patient is on GLP for diabetes or diabetes. Okay, thank you so much. My next question is to Dr. Hina. So, Dr. Hina, there is many times the patient may call you and ask you that, ma'am, I am just going through here and there in such a high heat, and I am feeling uneasy. So, it could be due to heat stroke, it could be due to hydration. In that case, it may be hypoglycemia. In such cases, how do you counsel that patient, and how do you tell them to what to do immediately if you get such kind of things?
Okay. First of all, thank you, Priyanka, for amazing introduction you always give. And you are looking lovely. All of you all are looking lovely in the summer at 4:30 in the evening. So amazing. Please continue sip the water. You all also. Okay. And yes, so when the patient are traveling in this summer heat, it's a vacation, as we all know. And definitely during vacation time, when the patient is going for a long trip or something, and in this summer, and we have to advise as per the medicines they are on. So, as we, for example, not all drugs, but SGLT2 in particular, because of excess water loss from the body by the molecule during the summer, there are chances of further dehydration escalation. So, if we can reduce the dose to half during that time, SGLT2 like empagliflozin, if the patient is on 25 milligram, we can reduce the dose, and especially tell them to take extra care in taking water for that matter during the trip, during the traveling, and not to skip meal, And if they are skipping the meal, they can skip the dose of insulin, bolus insulin, if they are taking, if they are taking glimepiride or gliclazide, so acarbose, so they can skip those medications if they are missing the meal. And during the time when they are not having the meal, we should be also sure about that the what last tablet they have taken. So when they are on very long secretagogues, they can lead to it can lead to hypoglycemia in the evening, especially if they have missed the lunch. So we should tell them that to keep some snack. It's okay to they can avoid the meal, but they should keep something to eat. Especially in the evening time, they can keep fruits with them. They can keep oranges with them. They are naturally hydrating, and chances of hypoglycemia reduces with the help of fruit. Uh, Most of the points are already covered in the by all the previous doctors regarding the topic. So especially if medicines, oral medications are concerned, these are the things. GLP-1 is been explained by Dr. Akshaya. Then uh, metformin can lead to during the summertime because of dehydration. Uh, you know, chances of uh, uh, lactose acidosis can lactate acidosis can increase. So if they are very on very high dose of metformin, we can reduce it. And yes, the advice also uh, is individualized and what medication they are on. It's very common to get diarrhea and stomach upset during the trips they are in, and they have to be careful with the dose. They should skip the dose if they are, they have conquered this infection of especially diarrhea and vomiting. So first thing they should do is stop the diabetes medication. They have to observe that the frequency, if the frequency is more, they should immediately rush to the nearby doctor or physician so that further dehydration is prevented, especially when the vomiting does not stop. And as it is very common to confuse between heat stroke and hypoglycemia during traveling, patients should carry their glucometer so that they can check their sugar and take a decision accordingly. And keep nimbu sharbat with them so that there is a little amount of sugar in it, electrolytes in the form of salt, so they can sip that continuously and avoid further dehydration. And if anything else I'm missing on, if somebody wants to add.
I think you have covered most of the point, but as we know, prevention is always better than cure. So most of the time, we have most of patients' number and which is saving our receptions number. So you can just start doing this. That you can start putting flyer of heat stroke and dehydration, hyperglycemia, and simmer in diabetic patient. So they are more, they more maybe not be confused the heat stroke with the hypoglycemia, also hypoglycemia at the heat stroke, and how to that with the help of the flyer or something,
Yes.
the social media message. So it really helpful.
Yes,
Even the
yes,
patient comes to
absolutely.
for the follow-up during this period of summer, even in the March, April, still you can counseling them before it happens that avoid hyperglycemia in this period. And in the summer, there is a tendency we eat less solid food and we tend to eat more liquid and semi-solid food. So in this way, can we also prevent hypoglycemia and dehydration and
Agree.
heat
And
stroke?
individually, we can advise the
Yeah,
patient. And to prevent infection, we should also prescribe other medications also.
yeah,
During summer, during change of climate, going from one state to another state, it might not be that much heat over there. And uh, I want to point out one thing is women, especially as a woman, we tend to avoid drinking more water when we are on trips, right? because we don't the clean, accessible bathrooms are not available nearby, and elderly females do that very often. And when they are on this spiritual trips or something like that with the group, many elderly people also plan in the summer vacation. So when they come to me, I tell them that there are many more chances of getting dehydrated during that time specifically. So yes, individualization helps. So what patient needs, what advise more. So yes, female patients tend to drink less water to avoid going bathroom trips. So we should always tell our female patients, irrespective, to take more water, and especially in summer, so that during in home also they can get heat stroke, as the humidity is very high in this summer especially.
Thank you, Ina. We are running out of time. Thank you so much. And my another question is to Dr. Sharanya. Welcome,
Hello,
Dr.
ma'am.
Sharanya, to Metabolic Women's Alliance once again. So
I thank you all for giving me this opportunity. So this
yeah,
is my first time in this group, and it's actually a lovely session to attend.
we are also glad to see you here. Okay, but
Thank you.
my question is about technology, that is CGM. Most of our
Yes.
adult patient is using CGM. So I just want to know from you, from your clinical practical view, what complaints that CGM patient when came to you in summer days, what kind of complaint they have? Does there is any variability in detection of hypoglycemia during summer days and all these things according to your practical view?
During summer, especially when the people who tend to sweat a lot, then there is a problem with CGM. Especially if their hand is so much of sweat and it is sweaty, the adherence is a problem. So we have to make sure that the area is little more dry, and the proper adhesive tapes can be used to secure the device in position. So that is a very common problem with summer. Other than that, if the patient is going to be working in an IT sector, he is going to be not sweating that much, even though if the outside temperature is going to be high, then the device variability is not that significant. In that case, CGM reading is very good as a finger prick reading. And whenever the patient, if we are seeing during review, we have to be very cautious. If the CGM graph is correlating with the patient occasional fingertip pricks, then it's okay. The reading is good. And also, if the patient has a different feeling, perfectly fine. But if the CGM is showing lots of abrupt vertical and down slopes, uh, a CGM graph should be like a movie screen. There should be ups and downs. It is like a movie. So constant ups and downs should be there. Then the graph is reliable. If the patient graph is showing a abrupt vertical upstroke and sudden down, then we should always think of sensor disconnection, or there is some problem with the sensor. So in that case, the CGM adherence has to be reviewed. So this is the most important cautious thing when the patient is wearing CGM has to follow. He should not go by just by the device value. He should correlate with his symptoms also.
Okay, thank you,
And
thank you.
to keep them hydrated, proper hydration, as already many of them have spoken. So proper hydration is required because it senses from the interstitial fluid. So hydration is very important.
Okay, thank you so much. Okay, we'll back to Dr. Akshaya. She is drug specialist today. So, Dr. Akshaya, how do you counsel patient who is on SGLT2 inhibitors, a diabetic patient in summer days? Do you have a specially counsel them, or do you add some tips and do's and don'ts to them? Because we see SGLT2 even at any time of the way that they can cause urinary tract infection or any other fungal infections also. So, how do you counsel this kind of patient?
Yes, SGLT2 inhibitors generally considered safe during summers, but some precautions have to be taken. Mainly ask the patients to have adequate hydration throughout, maintain genital hygiene, And especially in patients, you should be cautious who you think are a higher risk group. That is mainly patients who there are chances of volume depletion in terms of any illness, dehydration, or gastroenteritis. Especially other groups, caution should be taken when they are elderly patients, mainly outdoor workers who are sweating, going to sweat a lot, and CKD patients, and mostly those on diuretics. So such patients, maybe like Dr. Hina said, we could alter the dosage a little if we know that the patient is going to be sweating a lot or going to be dehydrated. In such patients, we can reduce the dosage a little, especially for the summers. Either ways, ask the patient to avoid the drugs in case of acute dehydration, any severe illness, or mainly gastroenteritis or reduced oral intake, and avoid prolonged fasting. And mainly adequate hydration should help. And in case of any complications, monitoring renal parameters and blood pressure will definitely help.
Okay, thank you, Akshaya. Also, I used to make a habit whenever I prescribe any SGLT2, regardless of anything, I always have short notes that increase water intake more than your current water intake to half and 1 liter. Plus, I always counsel patient that this drug can cause this kind of issues only if you there is a
Yes,
deficiency of hydration, not because
yes,
of the drug, because of your hydration status is low. So I think
yes,
these kind of things make that even the summer, winter, whatever, more
yes,
easy
yes.
for us to counsel and avoid any infection or anything side effect of the such a wonderful drug SGLT2. Okay, so my next question is to Dr. Hina. Dr. Hina, I think Adhik Maas is started. Many patient comes to you that ma'am, I am keeping the fast, but बहुत धूप है बाहर. How I manage my things and how I should avoid hypoglycemia, dehydration, and summer related issue during my fasting. And also I'm not having good appetite as it was previous one. So how do you counsel such a patient?
So, if we talk about Adhik Mas, here in Gujarat, patient they eat one meal a day, and yes, one meal a day. But that doesn't mean they are not eating the falahar in the evening or in the morning. So because they are on medication, and if they want to do it for the whole month, so increase water intake and increase use of chas and curd, and uh, uh, I advise them and to take fruits like the summer fruit is our watermelon, which is very hydrating. And because of the high water content, they can in the during the falahar they can take around 200 grams of approximately 150 to 200 grams of watermelon also, so that they can feel full and hydrated. And I have to tell them to avoid potatoes and fried potatoes basically. So fried potatoes lead to more chances of not eating for a very long time, not drinking much water after that. So I tell them to take light falahas like khichdi of sama or something like that, and to take more of chas, liquid food as possible. If they can take soups, which can be used in falahar because they don't want to eat much. And yes, definitely we have to reduce the dose also, because mostly nighttime they avoid not proper meal and they are on falahar. So accordingly, we have to reduce the dose.
Okay. So out of the box question, do you recommend that don't do a fasting during this period?
Yes, I am not very fond of fasting because our Gujarati patient leads to eating more of carbs during their fasting, and yeah, this becomes a problem. So, in the name of falahar, they eat more as compared to in the their daily routine. They'll end up eating more, gaining weight, and increase their HbA1c.
Okay. Thank you, Hina. Okay, so my last question of this panel discussion to Dr. Sharanya. Sharanya, in market in the whole India, we have a lot of mango right now. Okay, we also get a good kind of watermelon and all the summer season fruits. So,
Yes.
as a diabetologist, what should we know about these fruits and how we should recommend our patient about this fruit intake, or even in the place of quantity, quality, GI index, and everything? How's your experience and what you want to share with us about this?
Actually, I want to make one thing clear today because many people, even patients themselves, they consider mango as a taboo fruit. They say my blood sugar jumped because of half serving size of mango. That's not actually true. It should be a part of balanced meal, and portion size is very important. See, when the patient is going to be on a low carbohydrate diet and their protein, and when everything else is taken in right amount, taking half quantity, that is 100 to 150 gram of mango per day, is definitely not going to do any harm unless and until when their sugar is already very much uncontrolled, like 350 or 500. But other than that, patient who are on strict diet with proper glycemic control, just having a 100 to 150 grams of mango per day is not going to do any harm. But even one or two slices of watermelon is going to make them hydrated, even though it's a high glycemic food. But when the other carbohydrate contents are kept low, when they can skip their samosas, they can skip their high oily fried items, and they can have it as evening snack. That's a midday snack. When it is taken as a midday snack, there is no harm and there is not much of glycemic variations. And also, in what form they have is very important. They should not consume it as mango juice or watermelon juice. It should be taken as as a fruit cut portions. That is going to reduce the sudden glycemic surge in their blood. So, what amount as well as what type, the mode of intake is very important. Definitely, any market mango juices should not be consumed, and even freshly homemade juices should not be encouraged. So it has to be eaten as whole, because when it is taken as whole, it has fiber content also. So it is going to give the benefits of fiber, and also even watermelon. The seeds has to be eaten as whole along with the fruit. So it is going to give the omega sources and good amount of antioxidants. So actually mango is good in antioxidants. So the right way, right time, and right portion is very important.
So, do you
Okay.
suggest, which mostly in our country, we take mango in the form of ras and with rotis or puri? So,
And in
this is
Maharashtra,
puri
Uh,
Puran
and non. Yes, ras puri.
as pulp, raspberry is when you add anything to that, ma'am? You do you add
Yes, yes,
the
yes. Here
jaggery?
people add sugar like blindly. And
Definitely that can never be allowed. So
yes,
any
but
extra sugars
diabetic
has to be
patient take justify okay, I eat without sugar, ras. But that's what I'm
whatever.
saying. Because of the carb intake,
Uh,
as far as the regional division is concerned, right? I advise, what mostly I do is to tell them to eat slices, 2 to 3 slices, because they will not understand in grams,
that's what.
right? Watermelon,
Yes, ma'am.
one slice, one full slice they can have. Muskmelon, 2 slices. Papaya, 2 slices. So it's approximately around 150
Yes,
grams. And to take in the evening as a snack. So that
yes,
will
ma'am.
avoid postprandial.
Yes, ma'am. That's what
Because
I say. They can have
Yeah.
one or two, just half the portion of a small mango.
yes, but
That's what
not
I
with
was saying.
meal.
Not with
Not
the
with
meat.
meal.
That's
Not
what
with
is a
me.
midday snack.
Yes, yes, yes.
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 And
So
tell them to run 10 rounds so that they use up the sugar.
That
if
I
they
also
want to
do.
eat whole mango, they have to,
Yes.
increase 2 3 kilometers more.
Exercise.
Okay, same way I counsel to my patient, focus on eating fruits rather than and portion
Juices.
size rather than what it has and what it has not. Because fruit is anyhow good for as an antioxidant, fiber, water content, and at least having a fruits is enough.
And that is why mango and watermelon is a summer fruit. So we should definitely advise them to take it because their diabetic portion size matters.
Yeah. Okay, so very wonderful discussion about the drug stability and technology in diabetes in summer. I hand over to Varsha to introduce Dr. Dhruvi and Dr. Nimmi.
Yeah, thank you for the lovely discussion from the second panel members. So thank you, Dr. Priyanka, Dr. Shania, Dr. Hina, and Dr. Aksha. So despite two of them being very new to our MWs, they've done a great job. And as the other two experts, now there's nothing to elaborate further on their capabilities. So thank you all. And to end our session and to wind off on this lovely discussion of today, we call upon Dr. Dhruvi, our founding member, and we invite her to give her expert comments on these two topics, summer care and diabetes. Over to you, ma'am.
Thank you so much, Dr. Varsha. Thank you, every faculty who has been brilliantly discussing about the summer sweat and diabetes. I'm no expert to give expert comments, but from what I learned through the two panels, let me summarize that we need to tell all our people with diabetes that summer is a crucial time wherein they might lose their electrolytes. Dehydration is a major problem across all age categories, and hydration through water, coconut water, having proper supplements through natural ways like fruits is a very good source. Buttermilk, chash are again very good source. In geographies wherein there is too much of dry heat versus in geographies where there is a lot of humidity, people with diabetes will have their own troubles. Women who refrain from drinking water so that they don't have to use public washrooms, use of SGLT2s, fasting during summers. These are some very crucial counseling points that we need to include in our education process when we are counseling our people with diabetes. So I just want to say that include all of these points. Let's not forget to advise monitoring for all of these people with diabetes, monitoring of their blood sugars, monitoring of their weight, monitoring of their blood pressures as well. People in the age category of 55 and above will tend to have some troubles with their blood pressure. The variability of blood pressure will be too high in summers like these, which are very dry, as well as in places wherein there is a lot of dehydration. Let us ask them to wear full clothes. Let us ask our people with diabetes to use a lot of sunscreen, refrain from going out in the sun. So these are some very, very general counseling tips that we can give to our people with diabetes. And I again thank Dr. Nimi, Dr. Priyanka, Dr. Varsha for doing such a wonderful job in putting together yet another successful episode for MWA. So over to Dr. Varsha back again. Thank you so much.
Dr. Dhruvi, ma'am, can I add something? Though it is not very common, I think we always talk about dehydration, but sometimes even overhydration can be a problem in people who are drinking a lot of water just to hydrate themselves. So we need to watch out for that also, because hyponatremia can also occur in these patients, and the symptoms can be confusing along with hypoglycemia, confusion, dizziness. So for hydration, as you said, that it's very important, monitor the vitals, blood pressure, pulse. Again, urine output will be a very good indicator of how is your hydration status. So a very dark colored urine will be dehydrated. Colorless urine would indicate an overhydration state. So these things, and the output also, oliguria hai, zyada urine pass ho raha hai, all these things, probably we need to take care and counsel our patients for that too.
Absolutely, absolutely. So hyponatremia, especially in people with DKD, and in the geriatric population, even without DKD, is something that we all need to again screen, because they'll come along with very vague symptoms which are similar to generalized weakness, just feeling low,
Absolutely.
clouding. They might not understand what is happening with them. So these are the symptoms that we counsel them on, that if you are going through any of these signs and symptoms, please come to us. That's one major thing. When to
Yeah,
consult your doctor should be a very important counseling point for people with diabetes.
true.
I
Thank
advise
you.
every patient of mine, because it's a summer time right now, and we generally call them after 2 months, 3 months. So, chances of heat stroke and dehydration during this time in our elderly patient is very common. So, I get an opportunity to explain that and tell them, kuch bhi ho jaye, immediately come
Hmm.
to come to us. So this is an information to every patient
Right.
after the counseling.
So
Right.
thank you everybody for your wonderful inputs. Thank you, Dhruvi ma'am. And we've discussed a lot of things today. We've touched on a lot of practical challenges that we face. I think at the end of the day, we are going to go back to the basics of patient education and reiterating the same thing over and over and over again during each visit. And I think it also adds value when it's the doctor telling it to them, and besides the all the advice given to the patients by our dietitians, by our counselors, by our other guides as well. I think it makes a definite point, even if we just get spend that extra 10 to 15 minutes trying to counsel our patients during each visit. So we've learned a lot today. I'll hand it over to Dr. Nimi to give her comments and help us wind off for today. Thank you all for joining.
Yeah, before we sign off, there are multiple questions in chat box, and I want to take all of them. So let's start with the panel one. Anyone from panel one can answer this question. First question is, ma'am, even coconut water has good amount of sugar, so is it recommended for type 1 diabetics?
Ma'am, I think this question
We've
was
been
answered
through
by
these
Dr.
Yes,
questions. Yeah,
that's
yeah.
Sarita,
everything.
that it
Okay.
is good.
And second question, I think Dr. Ashna can answer. How can we assess if the patient is well hydrated or not, even in CKD or CHF patient?
Right. So just as we discussed right now, we should monitor the vitals. So the
Hmm.
pulse rate is a good indicator. The blood pressure, again, that's a good indicator. Urine output. See for the skin turgor. You can check their tongue, whether it is dry or no. That way you can know the hydration status. And especially in the heart CHF patients, you can ask them symptoms for, breathlessness, whether there is edema, pedal edema, swelling in the feet or not. Probably these are the some things which you can look out for. If I'm
Okay.
missing out anything, someone can add.
No,
Yeah,
I
I
think
think for that coconut water, tender coconut water is fine. And especially if the sugars are under control, we can allow them once in a while. And it should not be too sweet. I think tender ones are okay.
not the packaged ones, especially.
Yeah.
And ideally, coconut water should be taken in place of a fruit. So mid-morning and evening is ideal time, uh, not to have an as add-on with the meals. The same rules for fruit. Now, next question is for Dr. Pavitra. In summer, will there be any change in the glucose range for patients? So the tight time in range, TTIR, we reduce it, we increase it, or do we stick to the regular TTIR?
Hi, ma'am, it's for me.
Yeah.
Yeah, I
Yes,
think I can answer because
anyone.
the time and range, what we expect is at least more than 70% of the day.
Hmm.
That's what we actually target. No one can be
Hmm.
in time and range for 100% of the day. That is actually
Hmm.
practically impossible, especially when the junk amount of patient is from the elderly. So, in summer, sometimes false high sugar alarms can be there, especially when the patient is dehydrated because of the sudden dehydration when there is intravascular compartment contraction. hyperglycemia can be there. There's a false hyperglycemia. And whenever you have a doubt, you can hydrate yourself, or even before you hydrate, if you see that the jump in sugar is too high, and all of a sudden, that's what I told already. It should be like a movie graph and should not be just like a mountain slope. So if there is some mountain slope which we see in our CGM, then it can be a false alarm. So we have to double check with a finger prick reading. And if such cases are coming, we have to hydrate ourselves so that the interstitial fluid volume is adequate and the water content is adequate. The CGM value also will be, it will correlate clinically.
Okay.
So there is no hard and fast rule for summer or like winter. Whatever the season, 70% of the time and range is the target. And beyond that, if there is if we see some erratic graph, it has to be verified.
Okay.
So we have to educate the patient.
So irrespective of the season, the time in range, which is between 70 to 180, and time in tight range, which is between 70 to 140, stays the same. Okay. Now, my next question is, can DAPA or other SGLT2 can increase or worsen chances of UTI in volume deficit case? That's question one. And second is, which other drug can be advised instead of SGLT2 inhibitor if we are withholding them or reducing the dose due to UTI maybe?
Actually, ma'am, definitely I see an increased frequency of urinary infection during summer, whether they are on SGLT2 inhibitor or not. When they are on SGLT2 inhibitor, definitely the chances of mycotic infections are going to double. So first thing will be the hydration. If at all the patient is having troublesome mycotic infections, which is resistant and refractory and recurrent, they will change the doctor. So before they change the doctor, we have to change the drug at least for a temporary time till the patient is coming out of the recurrent infections. You can even give depending on the patient, depending on the clinical context, depending on the adherence, you can put the patient on a different group of drug. If the patient is not going to be on DPP-4 inhibitors, we can try that group. Or if the patient is not on any other sulfonylureas, you can give minimal. Or if the patient is not on metformin, you can add, depending on the patient, depending on their previous prescription in which they are. So you can obviously go for second line drug. And with the advent of all our GLPs, now you can very well change them to GLP also, which carries similar MACE benefits, just like our SGLT2 inhibitors. So patients with already on SGLT2 inhibitors, and definitely if they've suffered even one episode of pyelonephritis, we are not going to restart again. So in that cases, definitely you can go for, with the latest advent of GLP, you can go for this. That will give the equal or even better outputs also, because considering the weight loss and the MACE benefits, definitely you can switch over to GLPs.
Correct. Now, the next question is for panel two. I agree with Dr. Vani when they say that GI index of watermelon is comparatively high. It comes under the high GI fruits. So, can we replace any other fruit with watermelon instead of watermelon? Can we advise any other summer fruits apart from mango to our patient?
Generally, we see watermelon, mango, muskmelon. Even the problem with banana is it is high glycemic. But because of the glycemic load is less as compared to other fruits. If you talk about muskmelon also, it is lesser. The glycemic load is, because of the watery fruit, the load changes. Right. So being high index also, because of the water content in that fruit, it is the best fruit to have in summer. Even diabetics can have it. And as compared to mango, I would say it does not increase that much sugar. They should not take juice. They should take it in the form of pieces. They can also use some salt also, so that the hydration part is covered, the electrolytes is covered. So yes, watermelon is advised as a mid-meal, and the portion size matters.
So, less than 100 grams.
Not less than 100 grams. We can definitely give them 150, the whole slice. You can get, the sizes of watermelon are different. So we can tell them the sizes of katora or katori utensil. So the ideal form of
One small bowl.
measurement in our country is the katora and katori, right? So we can tell them that the small katori is around 100 grams and the medium form of katori is around 150 to 200 grams. So yes, that much they can take safely. And because of the water load, glycemic load is less irrespective of the high index.
Okay, there is one more fruit that is known as ice apple or targola.
Targola.
Yeah, it
Yeah,
is
but
also
same,
many stalls there in the summer days. It's been sold out. It is good for hydration, nutrition, electrolytes, and it has a good taste also. It is actually having natural sugar. Okay, so it's not give you the sudden spike in your sugar, but it is good fruit and also cost worthy.
we don't get targola in Gujarat.
No,
I miss
Mumbai
it.
you will get in each square.
I
Sure.
miss it. I love it.
So, I think, and the last question is again, it's a comment by Dr. Rohit saying most of our patients are hypertensive and who are on ARB and AC inhibitors. Coconut water can increase the potassium. True, sugar is also present in coconut water. That is why we don't recommend it with the meal. We recommend it in moderate quantity, less than 100 ml of a glass, and to take it as a mid meal. And you actually can take coconut water over sugarcane juice. Most of our patients, they take sugarcane juice, ganne ka juice, thinking it is healthy. So instead of that, coconut water scores over it.
Definitely.
So
Then we can also tell them to have chas soda rather than limu sharbat because it will be sweet. So we can always give them options. This is better than this.
absolutely.
That
And
sattu shake also is there. It is made up of only sattu, black salt, and water, and some ice.
true.
Yes, it is a summer drink.
Yeah, it is summer.
Yeah, yes.
India as a country is very diverse. So if you go to the southern part of India, you have Amti. If you go to the northern part of India, you have Kanji. And in Gujarat, Maharashtra, we have chas and buttermilk. So all of our traditional liquids or drinks except amras is good for our diabetic patient, I would say. So with this, I would like to close this webinar for Metabolic Women's Alliance. And the group was created for this exact same reason, for everyone to be on the platform, have an open-ended discussion. And I thank Dr. Varsha for the concept, for the execution of this topic, and the wonderful discussion that both the panelists and moderators conducted. So with this, I conclude this webinar. And be active in the group and add more members in the group, and join us on Instagram and Facebook as well.
And thank you, RX, for
Thank you.
yeah,
Sure.
presentation.
And we will be sharing the recorded webinar also link. So if anyone is interested and anyone wants the link, do connect with any of us here.
Thank you so
Thank you.
much.
Lovely to meet
Thanks,
you all.
everyone.
Thank
It was
you,
a
everyone.
pleasure to interact. Thank you.
How can you connect? Dr. Rohit Shah, you can connect with either me, I'm Dr. Nimi Mulwani. You can connect with Dr. Dhruvi Hasnani. We both are from Ahmedabad. And you can connect with Dr. Priyanka. She's in Pune. And you can connect through Instagram. Just look for Metabolic Women's Alliance.
So thank you so much, everyone.
Thank you.
Thank you, everybody.
Bye, everyone.
Bye.
Bye.
Have a good
Bye,
day.
everyone. Bye.
Bye.